Hi everyone, my name is Jade Pettitt. I did my in-service on mental health and pediatrics secondary to COVID-19. This slide is just my table of contents. Slide 1 is the cover slide. Slide 2 is the table of contents. Slides 3 through 7 are content based on the issue. Slide 8 is ways to help cope. Slides 9 through 14 are how to help and the benefits of therapy, including occupational therapy and recreational therapy. And slides 15 is the conclusion and 16 are the citations. Many people actually think that since children are so young and don't quite have a full understanding of what's going on, that it would not have any effect on their mental health. But that is actually the opposite. Because they don't know what's going on, it is actually having a much larger effect on their mental health. So what are some ways you think being a child isolated would affect their mental health? Some ways is a lack of predictability in schedules. They usually no longer have a routine. Lack of peer interaction and all social interaction. Too much screen time, whether on Zoom for school, parents letting their kids play games all day, watching TV, etc. And increased neglect being at home. Why? Children do benefit from having a routine and a schedule, and sometimes it is difficult for them not knowing what they're doing next. This usually applies to all children, but it is definitely much worse for children with special needs such as autism, because a lot of the times when they don't know what is coming next in their day, they start to get very anxious. Another reason is many children have lost the ability to interact with peers and caregivers secondary to COVID. They're no longer at school every day interacting with their friends, having playtime with their friends, and even a lot of the times they are no longer with their parents, whether their parents are working in the medical field, they're quarantined, or any other reason. Many children have increased screen time due to communicating through the internet, increased gameplay, whether it's schoolwork, homework, or anything. And the numbers of neglect in households have increased tremendously due to frustrated parents to increase family time. I looked at many studies that show this because of parents are home with one or multiple children. They're trying to do their work at home. They're trying to help their children with schoolwork. Their children are just being crazy and they're getting very frustrated and don't really know how to handle it in the right way. A child is still developing, and although they aren't as likely to catch the disease necessarily, they're more likely to deal with the emotional side effects such as anxiety and depression, clinginess. They're scared to ask about the disease because they don't know how their caregiver will react to it. A lot of them are having increased nightmares and increased distractibility. As a child is still developing, social interaction affects a large part of their development, and that consists of interacting with family and friends. As a child development, social interaction is one of the largest parts. So it is very important that a child has that on a daily basis. And with them being isolated or quarantined and every family handling it different, some children are becoming very anxious and clingy and don't really know how to react to the situation. Some children have been isolated from their parents due to quarantining because of the disease, whether their parents are working in the health field and don't feel comfortable coming home, or if they traveled and then found out they had to quarantine for 2 weeks after. Regardless of what the situation is, these children don't quite understand it, and they just know that they aren't allowed to see their friends and caregivers for whatever reason. They have decreased social and playtime with friends, which can also lead to depression. I know a lot of parents don't necessarily think that their kids can have anxiety or depression because they're too young. However, they can, and a lot of the side effects of the pandemic are very much so hurting their mental health. And most children no longer have a routine or schedule, and this can make them very anxious, especially kids that benefit from it. What a lot of parents could do was create a routine with them, even being at home all day. And they can even make like a visual schedule for them, but a lot of parents don't really know how to go about it, and so they just haven't been. And it is affecting a lot of children in a very negative way. This is just some ways of helping children cope, because unlike an adult, they really do not understand what is going on. So a lot of their reactions are fear of being alone and nightmares, speech difficulties, loss of bladder and bowel control or constipation, change in appetite, increased temper tantrums. This can usually happen because when children are scared, they just want to get that across to you and express their needs, and they don't always know how to in the best way. Sleep pattern changes, irritability or whining and aggressive behavior, clinginess, sleep disturbances, and physical symptoms such as headaches or stomach aches, which can come from an increased level of anxiety as well. And right here is how to help. So it would really be beneficial to your child or a child that you're caring for if you have increased patience with them and just tolerate it and figure out ways to cope between the two of you. Provide them reassurance that it's going to be okay, because again, they really don't understand what's going on and they don't know when it's going to end. Encourage expression through play, reenactment, and storytelling. This is very important for you and your child, because creating activities or letting your child play in a way that will express how they feel can actually help them a lot. Allow short-term changes in sleep arrangements, whether they need to sleep with you or on your bedroom floor or anything for a short period of time. Plan calming, comforting activities. Maintain regular family routines and routines for your child as well. Avoid overused media exposure, so your child's not having increased screen time. And make sure that they're getting enough play, because I know it's sometimes hard for parents to find enough free time in their day, but you have to also think about the changes your child is going through and make sure that they are still getting enough playtime since they are no longer with their peers. Ways to help. Occupational therapy is a big way to help a child, especially in this case. Occupational therapy is the only profession that helps people across the lifespan to do the things they want and need to do through the therapeutic use of daily occupations. Occupational therapy practitioners enable people of all ages to live life to its fullest by helping them promote health and prevent or live better with injury, illness, or disability. Some benefits of OT. OT can help in this situation with children that don't have a disability, just maybe need some help with their mental health due to COVID. And OTs can really help that. They can collaborate with the child and family to create a routine with a visual schedule, because a lot of times this does really help calm a child down and relieve their anxiety. OTs can also focus on calming techniques between the child and family when they begin to get frustrated. This can reduce the levels of neglect within households, because not all people understand. Sometimes they lose patience after a while, and increasing ways to cope to calm them down as well, can not only help with the rates of neglect, but if you have calming techniques before bed, it may be able to help them sleep better as well. OTs will focus on the child's main occupation, which is play, which will improve their mental health, and they can also include DRI floor time, which will help, because this is focusing on what the child wants to do with play, and that can have a big impact on their mental health. And they can also create any interventions based on the child's needs and interests. Again, the child does not have to have a disability, but they can help families and the children itself with many ways on how to improve their mental health due to the pandemic. What are other therapies that could help benefit these children? Recreational therapy is another type of therapy that I haven't had much experience with yet, but they use the means of therapy to help the patient, or they use play as the means of therapy. A lot of the times they will use music, dance, and crafts within their sessions. This helps a person express how they're feeling. A lot of the times will make them happier, and it will allow them to do what they would like to do within a session. They try to help their patients bring in positive changes to their life regardless of what the situation is. And they often use leisure activities to help support people with mental health issues, cognitive abilities, and much more. So because they're so used to using leisure activities and play to help support people, in this scenario where the biggest problem is children's mental health, they would definitely have a very positive impact on these children's life because they are using play and what the child likes to do, like certain activities, to help improve the child's mental health as well. How does this help a child with declined mental health secondary to COVID? It helps because they allow children to express their feelings in a positive way and be creative. A big problem with this is that children aren't able to express themselves right now. A lot of them are too scared to, or they just really aren't sure how to. And so that is a big issue within children's lives and their families right now. It also allows them to have social interaction with someone who doesn't live in their home. Right now, children have limited access to socialize with anyone that isn't in their home due to COVID. So bringing someone else in or going to a therapy session, even though it is with a therapist, they are there to help you and to play or basically cater to what you are interested in and would like to do. So that would be a very positive experience. And it gives them a chance to create or do something that is meaningful to them. And lastly, it can help with their family as a whole and build a better and more calming relationship among the family and within the home environment. A lot of the times right now, so many families are just so stressed out, they really don't know how to react, even parents. So this can be very beneficial to the whole family. My conclusion, COVID-19 has had many negative effects on children for a variety of reasons. Some children feel very lonely, scared, frustrated, and anxious. And recreational therapy and occupational therapy could help improve these children's mental health by allowing them to express themselves and their emotions along with doing activities they enjoy. And because of them not being able to do this on a regular basis now is a big part of the decline in their mental health, which is why bringing these therapies into their lives could help their mental health. And then my citations. Thank you.